Welcome to MindWise, a video podcast and newsletter that presents holistic mental health, healthcare, wellness perspective, and information. I am your host, Ron Parks, MD, writer, teacher, and consultant. The following podcast is about a family in turmoil over the treatment of their son diagnosed with ADHD and the tough choices. Dr. Parks shares his experience and what the research suggests as the best options. Careful evaluation is vital in getting to the root of the problems, triggers or influences for the best treatment. The downside of defining an individual with a label or diagnosis is that opportunities for successful intervention and comprehensive treatment can be missed. The confusion between DVSD, Developmental visual-spatial disorder, and ADHD, Attention Deficit Hyperactivity Disorder, and ASD, Autism Spectrum Disorder, is discussed for your understanding and finding the best approach to treatment. Visual-spatial disorder understanding and future research may bring the best help in prevention, early life interventions, and other treatment. ADHD, a misdiagnosis, a label, or lost opportunity for the best treatment. ADHD may be a developmental visual-spatial disorder, noted as DVSD. A parent's conflict over the treatment of their son diagnosed with ADHD. A close friend and colleague sent me an email asking if I could assist a psychotherapist with a troubled family that needed support from someone knowledgeable in both medication and non-medication approaches. When I spoke with the therapist, it reminded me of the significant polarization regarding the best approach, such as modern medical science versus holistic medicine, as well as advocacy for more natural and lifestyle intervention. I realized that bridging the gap in a troubled family would be challenging. In the news today, the same type of conflict steals the headlines, with people railing against science, research, vaccines that have saved many from the scourges of epidemics, death, and disability. I was one of the fortunate survivors of polio as a child before the polio vaccine, yet I know multitudes were not so lucky and were afflicted with lifelong disabilities or died prematurely. The situation surrounding polio and vaccines has been a modern-day miracle for many. The debate over the best approach and the need for less dependence on science and medical authority has led to a crisis in families and national politics, marked by angry polarization. When considering the psychotherapist's difficulty in addressing family disruption stemming from conflicting viewpoints on ADHD, what should both the mother and father understand to collaborate and potentially compromise to best help the child? The problematic student, getting to the roots of the problem. Early in my career, I was a consultant in a day school specializing in helping children considered poor learners and problematic students in the public school setting, often with poor academic performance and disruptive behavior. I remember one of the children who was small for his age and was frequently bullied by other children. Most of the time, he would sleep in the classroom with his head on his folded arms, falling behind in his classwork. Teachers and his grandmother insisted I put him on one of the stimulant medications of the day to help him. He was thought to be ADHD. When his grandmother, he lived with, and caretaker was interviewed, and a team member of our staff made a home visit, It became clear he wasn't sleeping more than a few hours a night, as he drank caffeinated sodas most of the day, and at night too, with him watching TV into the late night hours. Also, he was furious and an unhappy child as other peers in the neighborhood bullied him. In addition, he would receive punishment from his grandmother when he was late coming home, avoiding the threatening children who tormented him on his way. As a special design school program where I was working was well funded by the county school system, there was specialized staff that could not only do home visits but work with him and grandmother in the home setting about simple and effective changes to allow him a quiet sleeping space without a TV, improve his diet with avoidance of caffeine, especially in the afternoon and evenings toward bedtime. Also, strategies to build his self-esteem and confidence were made, such as after-school programs where he was involved in activities that interested him and taught him skills. One unique program was with peers where he learned cooking and nutritional skills so that he might be a chef in the future, which he loved. Interventions were made to help him protect himself from bullies. Efforts were made to identify and intervene with the children threatening him. Also, the school curriculum was changed to have more in his area of interest, where his learning style allowed better mastery. With these available services in a specialized school program, he did well, was more attentive and focused as a learner, and his mood improved with less anxiety. Of course, in today's world, with education funding being cut back and programs with staffing, the specialized program where I worked will be eliminated. Unfortunately, more children would go without their needs being met, and there will probably be more use of medications in the hope of at least short-term benefits. In my experience, many treated with psychostimulant medications such as Ritalin or Adderall or other ADHD-specific interventions do not benefit as expected when more productive and essential needs are not addressed, such as critical immediate needs, environmental factors, and adverse lifestyle. The medications can show benefit for hyperactive, disruptive child or adult with angry or dysphoric moods. Benefits, unfortunately, are not often sustained. Medication side effects can lead to poor compliance or cessation of the medication. Stimulant medications can, in some, energize a mind bored with a non-interesting or stimulating environment or exposure to under-stimulating educational material for a particular person's interests. The critical importance of the complete story and finding the hidden influences and triggers. Is it more genetic, environmental, lifestyle, privilege, or perhaps adverse trauma or events that affects one's career, health, longevity, successes, or failures? A serious look at what the leading influences are and the issues that would be helpful to address is the most beneficial direction to first take when diagnoses are given. Healthcare providers and researchers' experience suggests that both adverse and positive influence, such as environmental impacts, family, early childhood experience, toxic exposure, trauma, the presence of absence of a healthy diet or supportive relationships, not having restorative sleep, the deleterious stress, not enough exercise, the use of alcohol, tobacco, or drugs. All these can affect health, emotions, and performance, and social connectiveness. and longevity. Individuals can possess specific hereditary characteristics, sometimes linked to identifiable genetic patterns in genetic testing, or display a series of observable behaviors and cognitive traits and learning patterns that influence their performance or achievement. The downside of defining an individual with a label or diagnosis is that opportunities for successful interventions and comprehensive treatment can be missed. It has been estimated that 15% of American adolescents, it's about 7 million American children, according to the Centers for Disease Control and Prevention, have been diagnosed as ADHD. My experience treating adolescents and young adults in hospital and outpatient or office settings was that often someone would have a diagnosis of ADHD when coming in to see me. They often would have a history of treatment with all kinds of medications, like activating antidepressant medications, like bupropion, or psychostimulation medications like Ritalin or Adderall, or sometimes others helpful for ADHD. Some would have history of treatment with multiple medications, each of which was felt to be appropriate for mental conditions such as depression, anxiety, panic attacks, bipolar disorder, autism spectrum, and related problems, and PTSD. The prescribing of multiple medications suggests that many conditions or specific diagnoses overlap when using one particular diagnosis to explain everything. Diagnostic labels and treatments are added to define or relieve a new symptom or behavior. Unfortunately, as often the case, medical science has not found a simple diagnostic test to guide therapy when different or overlapping symptoms occur. A simple blood test or sophisticated advanced medical diagnosis equipment or artificial intelligence now is not available so far to identify the diagnosis and conditions discussed here as ADHD. Reliance is made on information gathering, physical examination, and history from reliable resources. When symptoms overlap and closely resemble other conditions or illness, it isn't easy to ascribe a simple diagnosis or intervention as a medication. Also, over time, the symptoms ascribed to one condition can remit or disappear later in one's life stage, suggesting perhaps other triggers or causes for what is seen or reported. Medication, if helpful, can be a transient phenomena and not sustain or be long-lasting, with a significant rate of non-compliance or stopping medications for various reasons, such as severe side effects, some of which can be quite significant. There's research suggesting that ADHD medication doesn't improve academic performance or learning, but that it may appear effective as it enhances a sense of well-being, energy, mood elevation when a boring setting with non-challenging or uninteresting tasks or educational material. The diagnosis of ADHD may be arbitrary, as there can be many other plausible explanations for any symptom or presentation. Using medication or what has been felt to be routine treatment might lead people away from finding interventions more appropriate and helpful. In several situations, I had to stop medication when they were inappropriately prescribed, as when a stimulant medication was given for ADHD when in fact they worsened or activated another condition requiring a different treatment. Some example I've seen is when a stimulated medication worsens trauma-related anxiety and panic, as seen in post-traumatic stress disorder. When extreme activation or mania or hypomania occur in someone with a propensity or history of bipolar disorder and severe mood swings, or when somebody with an autism spectrum disorder that is extremely sensitive or reactive to psychoactive medications such as stimulants, antidepressants, sedatives, or mood, behavioral affecting or regulating medications, has unexpected severe behavioral and emotional reactions. Solutions might be very well be for things other than medication, such as setting up or having a more conducive environment, a more engaging or stimulating classroom for students, a better work environment for a job holder, or especially a calm, supportive, and non-chaotic environment in one's home situation. The confusion between DVSD, development visual-spatial disorder, and ADHD, attention deficit hyperactivity disorder, and ASD, autism spectrum disorder. When observed, characteristic symptoms or pattern of dysfunction or illness are researched, systematized, codified. They may be then included in a diagnostic compendium such as the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, which is used by mental health professionals to label or diagnose neurodevelopment and mental health conditions, and also to aid in research, treatment, and public health efforts. The critical question when discussing ADHD, DVSD, ASD, or any learning or cognitive performance or difficulties become, what are the significant influences that bring about better outcomes, including adaptability, health, happiness, survival, illness prevention, and treatment? DVSD presents with similar difficulties in behavior as seen in ADHD or ASD, autism spectrum disorder. Although nonverbal learning disabilities, NVLD, is now the commonly accepted name, it has been shown by research to be a distinct type of learning disorder. It has not been defined sufficiently to be included in the official diagnosis in the DSM-5 manual. The current group of academics and scientists working to include DVSD in a future edition of the DSM believe that the best diagnostic term would be DVSD, effectively reflecting the primary deficit of the visual-spatial problems. They believe that this term and the future research surrounding it would enhance the identification of individuals with significant visual-spatial deficits and impairments, aiding diagnosis and treatment. Developmental visual-spatial disorders, DVS, is characterized by impairment in connectivity, communications, and development of visual-spatial information processing areas, primarily in the brain's right hemisphere. The reduced connectivity or availability to intellectual thought processing regions, mainly in the left hemisphere, makes visual-spatial skills less accessible and therefore less contributory. When significant dysfunction and difficulties arise, including social and spatial difficulties, DVSD is classified as a neurodevelopmental disorder. Individuals who predominantly learn and process information verbally with a reduced reliance on visual spatial process and memory-related brain regions generally recognize the disadvantages and challenges. Similarities or traits of DVSD are often observed in other family members. When greater genetic penetration more extensive genetic influences and impact occurs. It may manifest as this significant dysfunction that may require support and interventions. It is estimated that developmental visual spatial disorders affect as much as 4% of the children in our population. In both children and adults, sign of DVSD may include awkward responses in sports activities, as well as lack of fine motor skills and physical coordination, difficulties with depth perception, and hand-eye coordination indicate deficits in the visual spatial skills. Those affected may struggle with math tasks, using maps, interpreting body language, socializing, and relationship challenges, difficulties playing sports, or understanding physical objects in a spatial context. They find it difficult to visualize concepts in their mind or solve problems requiring visual imagery. Challenged with organizing, attention, executive functioning, nonverbal communication, mathematical reason, and visual spatial memory may also arise. Other difficulties may include problem solving, pattern recognition, understanding information, organizing thoughts and concepts for application in planning or adapting to new situations. Social skills and communication difficulties can arise from the inability to interpret motions through facial cues and body language. Unique speech patterns may also occur. Signals in social interactions are frequently overlooked, resulting in behavior or speech that is out of context or inappropriate for the setting. Challenges with executive functioning appear when the skills necessary for problem solving, organizing thoughts, planning, and executing actions are insufficient. Weaknesses in organization and planning may stem from the inability to break down a large project into smaller tasks or identify the necessary steps to start or complete a project. Occupational therapy, social skill groups, for example, provide valuable resources and interventions. Being hyper or hyperactive, worried or anxious, as often ascribed to ADHD, can be a prominent characteristic of DVSD. When relying more on verbal intelligence and intellect, there can be excessive agitation, hyperness, because of the diminished influence from the right brain areas, which may offer better perspective, presence, and a calming effect. A good workaround for this imbalance or excessive activation is to take planned timeouts, exercise, walk in nature, meditate, or vacation to regain perspective. Children and adults with NVLD can be marginalized, bullied, and isolated, facing social challenges or barriers throughout their lives. However, they may also have the advantage of verbal intelligence, cognitive processing abilities, and exceptional problem solving and speaking and writing skills, as seen in many scientists, professionals, analysts, artists, and individuals who excel in creative vocations, and information workers, which are professionals who use data and information to drive success in their positions. The brain's neurostructure can change through growth and aging, nurtured by the environment. This facilitates adaptation through learned workarounds and skill development. Where possible, other brain areas can compensate for those under-contributory or not readily available. DVSD symptoms or characteristics become less apparent with aging. When people recognize these features that cause fewer or minimal problems, they can be referred to as traits or as a verbal learner rather than as having a disorder or disability. Tips and points to ponder. 1, be open-minded and flexible in your thinking and attitudes. Always look beyond often restrictive or narrow reasoning beliefs or definitions to embrace broader perspectives, deeper understanding, making the unknowable more knowable. Be kinder and more receptive to new relationships. Embrace evolving wisdom, science, and paradigms to better care for ourselves and the planet. 2, adult and children behavioral, mental, brain, and physical abilities, along with performance characteristics observed from the early years of life, are often referred to as developmental in nature. As individuals age, especially towards the end of life, similar declines and deficits are frequently classified as neurodegenerative or neurodegenerative diseases. Our reflections on diagnostic labels emphasize the need to be open-minded to well-executed studies by credible academic researchers advising therapeutic interventions proven effective by research and studies. In Alzheimer's disease, medications may be available for agitation, but also when environmental management is insufficient. Non-medication approaches include minimizing or eliminating potential triggers by modifying the environment, creating a schedule of enjoyable activities for the person. 3, with the establishment of a diagnosed label, such as alcohol use disorder, for example, and the definition of the characteristics of the condition, there was a positive change in the recognition and acceptance of alcoholism, now referred to as alcohol use disorder, as a condition with which many people could identify. Self-help groups emerged due to the limited and mostly ineffective treatments or options available. They flourished because they successfully guided individuals into recovery and substance abuse-free life. Alcoholics Anonymous showed how healing and recovery is possible through fellowship, lifestyle changes, the power of support, and positive intentions, a sense of community, spirituality, and the connectedness that goes beyond the isolated personal ideas and limited beliefs. An integrative medicine psychiatry perspective looks beyond labels, symptoms, or characteristics to find understanding and positive treatment options for substance use problems. It is human nature to latch onto outdated ideas or beliefs about any issue involving disturbing traits, difficulties, and illnesses, medical or psychiatric diagnosis. Science and knowledge can evolve, can change, while the ingrained ideas and beliefs can remain stagnant. Therefore, do your best to stay updated with reliable and trusted resources. Keep an open mind, stay as informed as possible through your own research, study, and support from a trusted friend, advisor, or healthcare practitioner. Identify current changes that you can implement or programs that meet your improvement needs, and direct your attention and energy towards these areas where you can foster some benefits or necessary change. Practice kindness and love towards yourself, accepting those aspects beyond your capacity to change, at least in the present moment, as expressed in the simple words of the Serenity Prayer recited by Alcoholics Anonymous members. God, or higher power, grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. For the complete article and references, go to www.inmindwise.com. I appreciate your interest. Please share with others. Thanks to Sean Parks, editor and project manager, for valuable contributions in editing. Subscribe to Substack newsletter and podcast, again at www.inmindwise.com. All content is created and published for educational purposes only. It should not be considered as a substitute for professional or medical services or guidance. Always secure healthcare providers' care regarding medical or mental health conditions. This communication does not provide medical diagnosis, recommendation, treatment, or endorsements. Thank you.